Okay, today we have Barbara London of Freedom Eldercare. Barbara is a home care specialist. Freedom Eldercare is a home care agency, and I am proud to have Barbara on our show today. Welcome, Barbara.
Good morning.
Barbara, why don't you start out by telling us a little bit about your background and a little bit about Freedom Eldercare?
Okay, well, my background is that I started as a social worker and have devoted my entire career to the issues and problems related to the elderly, their families, and professionals. I started out as a nursing home administrator, then had a little bit of a stint with assisted living, and then for the last 9 years was doing something called private geriatric care management, which led me to twin that, and it was a natural kind of alignment with private home health care.
So you've really seen, you've had experience along the broad spectrum of elder care,
I would say so, yes.
And Freedom Eldercare, describe the company. What kind of company is it?
Well, it's really not your father's home care company. Our vision for Freedom was to create a service that was all-encompassing and comprehensive to either the older person themselves, the professionals in the field dealing with geriatrics, and, of course, the families, so that we have a combination of home care that is hourly, live-in, emergency, bedside in a hospital, wherever one calls home, in assisted livings, nursing homes, etc., and twinning that with a philosophy that aging poses a lot of challenges. And we added the geriatric care management component to assist people, guide them, help them with linkages to services and referrals they may need, so that at Freedom one may only need geriatric care management, only need home health care, or they need both.
Okay, so in terms of to help our audience understand how you can help them, let's say, for example, you get a call. I call in. I have a parent that needs some services. Walk us through what's the process and how do you assess what you think is necessary?
Sure. Well, often when the call comes, someone's in a panic. Some kind of crisis has hit, or they get information from a hospital that their parent's being discharged the next day, and home care and understanding the nuances and the services is a very, very daunting task to the average adult child, which is where most of the calls come from, or a professional referral. So first, we spend a great deal of time on the phone and try to educate the consumer about what home health care is and isn't. There still remains such confusion over what Medicare covers, the differences between Medicare and Medicaid. So we try to get an idea of what's happening in the older person's life at that time and how it's impacting on the entire family system. From that, we would normally, if time permits, arrange for an RN or a geriatric care manager to go out and assess the situation. As much as adult children love their parents or not, they often are ill-informed about what their needs are, or are very grateful for a professional to assist them to even know where to begin. From that, we determine what the amount of care is that the person requires, will accept, can afford, so that we do everything from some hourly assistance, which might just help someone with nutrition, getting up in the morning, getting dressed, all the way through dealing with oxygen, feeding tubes, living in, and becoming part of the family.
So you, in a lot of cases, I would imagine, you're helping out families who are spread, long distance, let's say. So children might be across the country,
Yep.
Mom and dad here in New Jersey, and they need somebody, they need eyes, ears, they need some type of assistance. And so I would imagine that there's real value in terms of what you do in those situations.
We believe so, and there's no formula. You're absolutely right, Yale. We have families that live in Thailand and get weekly reports by email about what's happening with their parent and coordinate every aspect of their life, from taking them to doctor's appointments to the opera. And then in other cases, we have families that live down the block but in the dual working parent and dealing with their own young children in many cases, we can allow them to just be daughters.
And so I think also in terms of what you do as well as I, some of the value is really sometimes the children don't really have an accurate dynamics as such that the parent doesn't want to hear it from the child. So I think you and I are in the same situation in terms of coming in as an expert, as an outsider, being able to break down those barriers. Isn't that right?
Absolutely. We're seeing very sophisticated adult children who understand the services that are necessary, who want to be dutiful in their devotion and obligation, but don't know how.
Right.
And very often the professional coming in is unbiased, doesn't have their own agenda. There's only one agenda, and that's how do we best help your parent. Mm-hmm. So that's a huge responsibility and a delightful place to be to really make a difference in people's lives.
Really rewarding.
Mm-hmm, absolutely.
Now, Barbara, I wanted to go back to something you said a few minutes ago in terms of misunderstandings, and you mentioned Medicare, Medicaid. Let me broaden that a little bit and ask you, what are the common misconceptions, common misunderstanding when you begin to work with families that maybe you could let us explain or clear up for our audience?
Sure. I guess the largest misconception, and though it's been waning in the last 5 years since I started my career almost 30 years ago, is that Medicare will pay for everything. I will get a call and someone will say, my mom needs help around the clock. Is this covered by Medicare? And one of the confusing issues regarding Medicare vis-a-vis home care is that virtually it pays for very, very little. It is post-hospitalization or an acute illness and often gives a couple hours a day, a few days, and then it disappears. So first there's that shock that it's not the panacea that everyone thinks it is. And then there's some anger as well. You know, my father was an immigrant and has paid into this entire life,
right.
And now you're telling me that it costs, this huge amount of money, or the perception of it. So first and foremost is that educational piece. Then I have people who don't even understand the difference between Medicare and Medicaid and use those words very interchangeably. So though it can be a sobering conversation, at least I feel that when we hang up the phone, they have a clearer view of what Medicaid is. And then Medicaid in and of itself is so confusing because there's Medicaid when one goes into a nursing home, and then there's Medicaid when one chooses to stay in the community, and that's a huge education as well.
Yeah, and in terms of Medicaid, and something that we've talked about previously, there were some significant changes to the Medicaid laws back 2 years ago, and one of those changes really is important in the home care field, because I'm sure you've seen this quite a bit. Folks may be more inclined to hire an aide directly because it is less expensive than going through an agency. However, and people are not aware of this, if they do that and they pay the aide cash or even a check, but there is no documentation, when it comes time to apply for Medicaid, and this is something I am consistently telling people all the time, that aid that they pay, let's say, for a year, could result in a Medicaid ineligibility period for a year or more. And this is after all their money is gone. So I always valued the services that, Barbara, that you and others in your field provide. But additionally, because of those changes, it really should be driving people to go to the agency, albeit it's a little more money, but you want to be sure when that money, if and when that money runs out, that Medicaid is going to be an option.
Absolutely true. It's interesting because there are differences in the quality of the care of a private versus the kind of what we call back office support of a licensed agency. And yet I understand when people feel that they need to conserve their parents' assets and they're confused about what the future will bring, if there's a difference in $5 an hour between someone you bring into your home who was referred by a friend of a friend or a newspaper ad, aside from the fact that they may not be qualified to deliver personal care and very intimate personal care, the financial aspect of it is really whatever the opposite of self-serving is. It can be very hurtful, as you say, because if one is interested or close to becoming Medicaid eligible for a myriad of services that significantly can change and alter the quality of life of an elderly person, then they are misguided in trying to save $5 here, $100 there, quite frankly, even thousands of dollars,
right,
which it could cost on an annual basis, thinking that they're protecting their parents' asset when, in fact, an uncertified aid or not going through a legitimate licensed agency, there is no proof that any monies were spent to care for the elderly person. And in a spend-down mode, doing it slower is not necessarily to someone's advantage.
Absolutely true. Barbara, I think our time is about up. I want to thank you very much for coming on the show today.
It's a pleasure, Gail.
Let me ask you, if people want to get in touch with you, how can they do that?
Well, they can call our office. We have quite a few offices throughout the state, but the main number would be 201-883-1200, or our toll-free number, which is 866-7-FREEDOM.
Okay. As always, if you go to our website, elderlawtodaypodcast.com, there will also be information, contact information for Barbara and for Freedom Eldercare. So that wraps up our show this month. As always, if you want to let us know your comments, we'd love to hear them. Just email us at feedback@elderlawtodaypodcast.com. Our website, again, is www.elderlawtodaypodcast.com. And I'm very excited to tell you, our audience, about our show next month. It will be a live call-in show. Robert, why don't you tell everybody the details?
If you'd like to be a part of this groundbreaking call-in show, you can be a part of the audience. You can participate, or you can listen in. If you'd like an invitation, please send us an email. The email address for that show is audience@elderlawtodaypodcast.com. That's audience@elderlawtodaypodcast.com. We would love to have you as a part of the show. This is your chance to get Yale's ear for a couple of minutes and get some no-cost advice that could save you thousands, if not hundreds of thousands of dollars down the line. We hope that you'll join us for that, and check the website for updates periodically on this upcoming show.
The date of that show, it'll be March 3rd, 2008, at 8 o'clock in the evening. So be sure to tune in then. And that's a wrap. Once again, thank you for listening, and we'll see you all next time.